Doc, so what about ano naman? What about how we show our appreciation of what doctors do? For example, just give you an example. Well, originally the frontliners, the medical frontliners, were supposed to be the first in line dun sa priority list. Medyo nagbago ng kaunti yun. Pumasok yung donations for the military, tapos hindi lang po sa military, pero even their families are now going to be included. Yung mga babakuna ng mga sundalo, pati yung kanilang mga pamilya. Pero yung mga frontliners ng medical, medical field, hindi po kasama yung families nila. I don't mean to try to compare the two of them and pag-awayan sila, no? Pero at least when you look at these two examples, how do they make you feel in as far as how we give priority to what you do?
I think we should trust. We all trust. We put our trust in the process, and the process is FDA authorizes a drug.
In an emergency
use authorization. Dahil incomplete data. And when that's done, hindi pa tapos. There are 4 steps kasi that assure us that we get the best vaccine. The emergency use authorization by the FDA. The next is the recommendation by the Health Technology Assessment Council. Talagang we should all know what HTAC means because they will undertake a thorough, quick, comprehensive evaluation beyond what the FDA does. So they don't only authorize availability, they also authorize procurement of these vaccines. Mas mahirap yan, no? Very technical. The third step is merong prioritization and distribution by the Department of Health through the NITAG or the National Immunization Technical Advisory Group. The fourth step is distribution by the LGUs. May cold chain yan to make sure na pagdating sa atin, okay pa din.
Effective pa yung vaccine, no?
Doctors, feeling nyo naman na susunod yung process. Kasi merong mga, naman na may recent developments na mukhang...
Except for Montulfo, ha?
mukhang na-bypass yung process.
Maraming sanggapang
For certain sectors.
Wala
naman kayo malaking reklamo doon.
Kasi yung
minention ni
Sinovac.
Oo, yung sa Sinovac.
Isa pa lang.
So na EUA pa lang siya nagbigyan pa lang siya ng authorization ng FDA.
First base pa lang yun.
First base pa lang yun. So ang gusto nga sana namin ng HPAC, yung Health Care Professional Alliance, is sana sundan natin yon. So after the EUA, dapat dadaan niya ng HTAC. Kaya lang sinasabi nila donation. So hindi po officially ipo-procure ng ating government, no? So doon nagkakaroon na kami ngayon ng discussions para nga we want to make sure na dadaan sa proseso and hindi magugulo yung ating priority list.
Hindi maunahan.
Yung sa FDA kasi sinabi nila baka hindi ganun kabisa yung ating yung vaccine na yan sa healthcare professionals. Hindi naman nila intention na okay, ibahin yung priority list. Ang basihan ng kanilang decision is the data that they have. On our side naman, hindi namin masabi okay ba o hindi kasi wala pang published paper, yung Sinovac, for their phase 3 study. So, even the HTAC, ang HTAC ang bilis kumilos, ha?
But you're saying po that because it's a donation, it exploits a loophole or basically gives it a workaround sa HTAC?
Ano pa lang, we're talking with DOH, we're talking with HTAC, we're talking with FDA, and I think there is now a general agreement na kahit donated yan, it should undergo an HTAC evaluation, which is the second step. So I think there's general agreement and we're happy and we hope that it really happens. Kasi kung hindi yan dumaan sa HTAC, parang who can be assured that it is a safe
linawin ko na po, that's general agreement on the public health sector side. Not general agreement with the IATF, say.
We haven't talked to the IATF actually. We've talked to kasi yung sinasabi naming agencies natin, FDA, the HTAC,
The NITAG.
the NITAG, and then the LGUs, di ba? So we've talked to them, but not to IATF yet. So
We're expecting that this will be turned into a national policy to follow the prioritization.
yes,
With
because
the presentations you are making. Kasi you're moving it through the FDA, di ba? Inaasahan na aakyat to sa IATF.
aakyat sa HTAC. Kasi ano to yung process na to, lalo na yung FDA and HTAC, that doesn't have to be approved by IATF. That's mandated by law.
Yeah, yeah.
So-
Yeah, that's really the process,
Yeah, yeah.
right? So you're saying that even if it's a donation, it should go through the process.
Yeah.
Doc, sorry, babalik lang ng konti. Yung ano yung kaibahan ng FDA decision dun sa HTAC decision? Kasi I thought they were both talking about safety of the vaccines and efficacy. What's the difference between the two approvals?
So yung the first base, yung FDA, they assess mainly safety and a bit of efficacy
Okay.
of the vaccine, no?
So
And
primarily
then,
safety.
Second base, yung HTAC, goes into things like impact. Ano ba ang impact niyan sa atin? Kasi it affects not just the number of cases and deaths, it will also affect our economy, businesses, the incidence of hunger. They look into the legal aspects and the ethical and moral aspects, how it will affect the poor. So it's very technical. Alam nyo yung health technology assessment is at least a master's degree. In other countries, it's a PhD. Mabibilang natin sa dalawang kamay natin.
Okay.
Kaya niyan. Pero ang pinaka-importante, the HTAC is mandated by law to do an important thing. Protect itself from politics and financial interests. No? We've done our investigative work. We looked up the members. Wala kami talagang makitang conflicts of interest. Right now, you hear people talking about this and that vaccine and this is better or that is worse. They have to declare their conflicts of interest, but they're not, mandated to do that. HTAC is mandated by law to address that and manage conflicts of interest. So we put a lot of trust. We feel secure that they will make the right recommendation unaffected or uninfluenced by politics and commercial interests.